Autism is a disorder where people have problems in three areas. One is in communication. The second area is in social interaction, how they get along with other people. And the third area is their range of interests. There are grades of each of these, ranging from mild to severe. So for this reason, we call it a spectrum. The latest estimates from the Centers for Disease Control are that 1 in 88 people are diagnosed with autism spectrum disorder. The risk is even higher in males, where 1 in 54 males are getting a diagnosis on the autism spectrum. We don't know what causes autism right now. We do know that it has a strong genetic tendency. There are several genes that have been identified as having an increased risk, but that doesn't begin to explain all the cases of autism that we are seeing nowadays. But since we don't know what causes autism, we aren't really able to prevent it.
Ask people to describe a child with autism, and you're likely to get a stereotype.
A child that's nonverbal.
Inside themselves, cut off from the world.
Who doesn't understand language.
They don't think the way they should think.
Rain Man. Everybody says Rain Man.
Has difficulty communicating.
Someone who's severely intellectually disabled.
While these descriptions apply to some children with autism, it's not the full picture. Once you understand what autism is and how it affects individuals, you'll be better prepared to teach students with the disorder and successfully integrate them into your classroom.
Take my hand.
I'm not naughty. I'm autistic.
Okay?
No.
Go by bus?
Mommy, then go by bus. Yes, borrow the car. Yes, I don't understand. Yes, I know must be a Honda Fit. Must be a Honda Jazz. I know must be a Honda Jazz.
Why not after this we take a bus, we go to motions?
The most painful thing is when we bring him out. There was one time he threw tantrum in public and everybody was looking. So I got so angry. I said, there is nothing wrong with him. He is only special, and I cried, of course. When he was about 3-4 years old, he had no speech. Doesn't have speech, but he can remember the routes very well. Even places he hasn't been, he will guide the father to go.
He's 6'2" and he weighs 252 pounds. He can go through this house and just wipe everything out probably in 10 minutes. You know, the destruction is just unbelievable.
10 signs of autism for a child 18 months or older. 1 in every 68 children are affected by autism. Did you know autism is treatable? Doctors agree that early intervention is critical. Every month that passes without treatment slows progress. Warning sign may be a child's inability or desire to look in that direction. Warning sign may be if a child is unable to point, but hand leads or resorts to inappropriate behavior to get their needs met. If a child does not respond when you call them, possibly appearing in their own world, this may be a warning sign. A warning sign could be a child's lack of eye contact. In fact, they may even avoid looking in the direction of a person talking to them altogether, preferring to look at the ground or turn away. This is especially evident with people outside the family. A warning sign may be if a child is having difficulty following simple directions, often appearing as if they didn't hear or understand you. Warning sign can be if a child does not raise their arms to be picked up. They may even seem unaware of your intention to pick them up. If a child would rather line up their toys than play with them, this may be a warning sign. A warning sign may be a child's prolonged viewing of a toy from the side, out of the corner of their eyes. However, it may be a warning sign if done often, repetitively, and appears hard for them to stop when directed to. A warning sign may be a child who shies away from engaging with others, often appearing disconnected from those around them.
Parenting is hard, but parenting a child with a disability is astronomically harder. And providing parents with strategies that they can use is what empowers me every day. In autism, the primary areas of deficit are social interaction skills, language, and communication skills. That's your chair. What we offer at Yale Medicine is individualized treatment. Pivotal response treatment is abbreviated PRT. It's a behavioral treatment to support language development and social interaction. You want the rod? Yes. Yeah, sure. For each child, we develop objectives, so very clearly defined behaviors that we want to improve. I got another green one.
I'll dump the rest.
Victoria's goals when we first started working with her included making eye contact with the person she was speaking to, and also using her language to help her begin to engage in conversations.
What did you get?
I got the bird.
Oh.
A lot of the kids that we work with, Victoria included, love bubbles. And we can use these bubbles to motivate the children to communicate with us. So the child would need to use their words. A lot of bubbles or just one bubble?
A lot.
And then I'd reinforce it by blowing the bubbles.
We have found applied behavioral analyses, or ABA, to still be the most effective and established treatment program for autism. ABA has, firstly, over 1,000 journal articles supporting it. Secondly, has gone through almost 50 years of experience, practice, and evolution. And lastly, ABA has strong research that shows almost 50% of children who receive good quality, early intensive ABA therapy are able to catch up to other kids their age. This means that they are able to achieve normal IQ as well as transition to mainstream school. Key strategies for teaching a child with autism. First of all, what is ABA? ABA is a scientific approach based on operant conditioning, which basically means that consequences have an effect on the behavior. This means that behaviors will either increase or decrease based on the consequence. Now remember, ABA is not a curriculum that you can complete, but more so a teaching methodology. ABA should not be flashcards, punishment, rigid or robotic. Instead, a good ABA program should involve learning, both at the table, which is a structured setting, as well as in the natural environment. It should use positive rewards, reinforcement, be fun in general, and most importantly, be individualized to your child's needs and challenges. So in the next few lessons, we're going to be learning about the core basis of ABA, which is operant conditioning, as well as the 3 key strategies of ABA, which are breaking skills down, pairing with reinforcement, and providing sufficient practice.